Okay. To our monthly meetings, on 30th, beautiful Riverside Drive, New York. We'll start with a roll call.
When I call your name, please say President Jason Zimmerman. Chief Grace Gachua. President Andrew Dahl.
Present.
Tim Goffin or Dominic Batnelli.
Present.
Daniel Mizels or Dory Gutzman.
Present.
Robert Bristol, Max Goldfarb. Detective John DeGregorio or Edward Jarvis.
Here.
James Pointer.
Yeah.
Charlie Gilbert or David Steve. Joseph Shanker.
Here.
Michael Rayola.
Here.
Michael Badger. Glenn Lives.
Here.
Tina Becker.
Usually both here.
Diglio. Here. Nancy Benedetto. Richard Cooper.
Here.
Robert Ruby.
Here.
Andrew Hughes. Benjamin Fay.
Here.
Michael Coombs.
Present.
Euthymia Langsam. Brian Levinsky. Warren Barzilay.
Okay, thank you. So next up, there were meeting minutes sent to the April 22nd meeting and May 1st. Okay, just get an approval. It came from our members here. Raise your hand if you approve. Unanimous. Okay, next is the correspondence report, which is a little bit of a lengthy report. So I was reminded, again, very importantly, I think that we want to vote on our nominees. Okay. So the nominating committee, KP met on August 11th. The members were Leah Rogi, Lorraine Giordano, Laura Raven, myself, Marie Biglio, KP, Laura Briscoe. State the primary function nominating committee, which is comprised of 3 members of the board, and 3 members of the regional councils to review the nominees for appropriate broader representation and balance, as well as the expertise of individuals in the areas most appropriate for the period of the regional council elect at large state members. The following nominees were recommended for appointment at large members beginning July 1st, 2025. The first, Constantine Caraton, and followed by Stephen Pelosa, JD, yay. Members' terms for 4 years ending June 30th, 2029. The slate is being presented now. So how do we vote? Okay. So any nominations for the board? Besides to repeat that, nominations for the floor. But, yeah. So third time, the nomination.
1 minute or 25.
No, that's
one meeting.
So any nomination from the floor, any nomination from the floor, any nominations from the floor. Okay. So I guess we will pass these out. We'll collect.
Yes. Raise your hand if you're a primary seat, please. Alternate voting for primary.
Oh, great. Thank you.
Great about voting now, I won't lose anybody, and you have a count from the end of the meeting.
Thank you.
Once you have your ballot filled out, just raise your hand. I'll come out around and plot. There are 2 names that were nominated by the nominating committee. So, 2 seats. 2 seats. Two.
15 ballots have been handed out. Sure.
Decisions over here.
Do 2 or you just gonna.
Oh, we can. Also. 2 seats and there's only 2.
Yes, but we had more than, I think, but nobody outside
Oh.
nominated anybody.
Joe. You don't have to come back around.
Two.
Gary?
Well, yeah, that works.
Okay. All right, so I'm going to proceed with the correspondence report, like a little lengthy. I'll try to get this in a timely way. First, regarding membership, I want to say that she, part of Florida, said letter to appointment for Grace and Casciola, Deputy Chief in EMS Operations for second term as the PD representative with Yvonne Sucheski as her alternate. Grace Casciola, Deputy Chief, Chief, sent letter appointing Lieutenant Kenny Chang, assigned EMS, BOT, as for the secondary representative, regional council. This will ultimately be Deputy Chief Mario Thompson. Joseph Shenka, MD, sent a letter appointing himself as REMAC representative for regional council. Dave Benelli, Dr. Benelli will serve as his alternate. Dr. Josh Hartman, former council, is able to be the alternate for Jason Zimmerman, Dr. Zimmerman. Applications for at-large nominations were received from Adam Gottlieb, Kirsten Press, Jacob Stabell, Councilman Carrington, Mark Mover, Mark Grillo, Matthew Smith Hamilton, Paul Joseph Manley, Stephen Baez, Stephen Floso. We select the nominees and we're having a vote today. In New York State Department of Health Enforcement, Wayne Allen, Louisville, New York, it is revoked effective September 26, 2025, for violations of 10 NYCRR 823. Benjamin Volunteer Animal Service Inc. Brooklyn, New York, it was revoked effective July 16, 2025, for violation of 10 NYCRR 822 and PHL 30121B. Amanda Yuki, it can walk to New York, suspended for 1 year effective August 12, 2025, for violations of a previous stipulation in the order. Stephen Tanner, Warwick, New York, is surrendered effective June 20, 2025, for violation of 10 YCRR and 800.16 Evan Torres, New York, is suspended for 3 years effective June 17, 2025, for violation of 10 YCRR 806. The suspension stayed pending no further patient abuse violation during the 3-year probationary period, assessed a $2,000 civil penalty. Montaka Sarkar, Queen Village, is suspended for 3 years effective June 17, 2025, for violation of 10 NYCRR 800.16. Suspension stayed pending no further patient abuse violation during the 3-year probationary period. Again, assessed a $2,000 civil penalty. Jasmine Garth, Newburgh, New York, surrendered effective May 14, 2025, violation of 10 NYCRR 803, 800.3M, and 100.5BA. Nathan W. Bird, Brooklyn, is revoked effective May 13, 2025, violation of 10 NYCRR 800.3, I think 1 and 800.3 assessed the civil penalty $2,000. Mark Dalton, Canton, New York, suspended for 1 year effective April 23rd, 25, for violations of 800.3 and 800.3A. Suspension stayed pending no further violations of PHL Article 30 or 10 NYCRR Part 800 for a period of 3 years. Assessed a civil penalty of $1,000. That's a lot. Daniel Howard, Patterson, New Jersey, suspended for 3 years effective April 21st, 2025. Violations of NYCRR 800.16A1. Suspension stayed pending no further patient abuse violations during 3-year probationary period. Assessed a civil penalty of $2,000. Timothy McCabe, Attica, New York, revoked effective April 2025 for violation of 10 NYCRR 800.15A1, 800.15A2, 800.3AM, and 800.3 AO. Mark Jeffries, okay, second in Jamaica, New York, suspended for 1 year effective April 1st, 2025. For violations of 800.16A7, the suspension stayed pending no further violation of PHL 30 or 10 NYC Part 800 during a 3-year probation period, assessed a $500 civil penalty. Enforcement actions for both providers and agencies can be viewed on the New York State Department of Health, Duty EMS and KT and Farm Service CMS display actions, enforcement actions page is a website if you would like to see it. New York State UH report, ambulance agencies, the Parcels Volunteer Ambulance Corps, FAPAC submitted a request to the New York State Department of Health. Director Ryan Greenberg seeking clarification on the definition of the proposed expansion territory under new certificate of need application. This follows REMSCO's unanimous recommendation following FHVAC's expansion to Queens County, specifically need void 4, which includes Corona and Elmhurst. Flushing bodies requesting guidance on Article 30 Health Law 3010, again, policy statement 11/06 regarding inclusion of the 110, 115 NYU precincts. It's noted that their current territory is bordered by a specific NYU precinct. Result they have in a two-way street. Any discussion on that or actions required? Roxbury Volunteer Fire Department requested clarification of their operating territory. They're in the process of renewing their certificate with New York State UH and the state is now requiring services to find their operating territories using political boundaries such as counties, community boards, police precincts, and zip codes. The Farmville Volunteer Ambulance Corps sent a letter May 5th, 2025 to New York City Regional EMS Council regarding application expansion and operating certificate. This correspondence follows a public hearing on April 30th concerning the application, expand application service to Queens County, zip codes 11368, 11369, 11370, 11371, 11372, 11373. The letter addresses the discrepancy where the New York City REMSCO Ambulance Committee advised against zip code based expansion due to potential security issues, while New York State Department of Health policy statement 06/06 requires expansion based on what was mentioned before the community boards, the KK, or other bodies. Ordained Regional Volunteer Ambulance Service, KK, otherwise Gotham Volunteer EMS, were approved by New York State DOH to expand their primary response areas, ultimately splitting territories by zip code. Specifically, Ridgewater Volunteer Ambulance Corps, KK, otherwise AKA Gotham, was reported zip code 11419 and 11421. Despite certificate of need, also referencing community boards, and Flushing Valley's own certificate of need designates primary territory by zip code 11415, 11418. So in addition to named areas, Flushing Valley attachments need to support their argument. Let's see other. Letter received from a resident of Linwood, Howard Beach, raising significant concern regarding a delayed emergency medical response times in the neighborhood following an incident in which the elderly individual required urgent medical attention and ambulance arrived approximately 30 minutes after multiple calls. A delay deemed unacceptable for a situation. Attempts to seek help from nearby West Hamilton Beach Volunteer Firehouse were successful with jurisdictional restrictions, and the Lindenwood Volunteer Ambulance Corps did not respond. The resident reached out to Councilman Joan Ariola's office, which confirmed the issue had been addressed previously, but Evolve Corporation technically responsible for covering the neighborhood. The resident is now calling for a review by EMS jurisdiction, accountability for response times, and the reassignment of coverage to a nearby agency if the current provider fails to serve the area adequately. The resident emphasized the urgency of addressing this gap to prevent potential loss of life. So as far as I know, it's not investigated so-called. Any
More comments?
comments from the audience?
I think part of the problem, general public needs to be educated about EMS response. And if this person fell down waiting 30 minutes, may seem like a long time. But I say we want to call and wait. But I don't know how we educate the public. Take the fifth.
Yeah.
I was just stating that I read the letter and it's understandable that they don't like that they didn't get a response in 30 minutes. But when you call in for a call, you're not going to get the same type of response as a difficulty breathing or cardiac arrest. And in a city of 8 million, you may not get a 5 or 10 minute response. You may get a 30 minute response. And I don't know how we could do it, but the public needs to be better educated what to expect when they call 911. But also, I guess, the directors, fire department. Look at.
Okay, thank you.
The fire
Yeah,
department will be releasing PSAs on the use of 911. We're just waiting for final approval on them. But yeah, you can refer this to us and we'll be happy to look at it.
Barbara?
Yeah, plates are normally sent to the QI committee, are they not?
Believe so.
Well, they could be forwarded.
Yeah.
They could be forwarded to the QI committee. They come in here as part of correspondence, and now they're going to the committee.
I would suggest that it go to QI committee as per our usual
Yeah, I agree.
procedure.
I agree. Any other comment?
Just what would be the task for the QA committee? What's the expectation?
They review they review the case, and see if there's anything that can or should be done.
Understood. However, a letter to REMSCO stating that there was a delay, the QA committee would have to then, the expectation is that we get the data from the fire department and review it that way.
We get the data from wherever we can. And review it. Yeah,
Just making sure.
Okay, so we'll refer this.
not trying to make this difficult. This is just what we usually do. Whenever this is like.
Sanders. Any difference of opinion? Thank you all. Thank you, Joseph. Moving along, there was a letter received from the town of Pelham requesting public need endorsement for regional councils in your state transition to a uni, like KKCON issued on December 12th, 2023, set up to expire on December 21st, 2025. To a permanent operating authority in Westchester County, New York, to include the provision of emergency basic and advanced life support and ambulance services. There's a registration flyer, okay, for quality improvement. Actually, I think this on your tables here. For EMS, for works of EMS leaders, co-hosted by the Regional EMS Council of New York City and Masonic, for October 15, 2025. Featuring presentation by Dr. Michael Redlander, Dr. Mike Dorset, Dr. Mike Tigeman. Registration available by QR code, which is on the flyer. A REMSCO approval of Forest Hills Volunteer REMSCO expense letter was sent to Abiy Sikran, President Forest Hills Volunteers, on May 27th, informing them that at the May 21st, 2025 meeting, REMSCO reviewed and voted collecting parcel volumes application for expansion of operating territory. The regional council approved the motion with a vote of 14 in favor, 0 abstentions, 0 opposed. Voting to New York State Department of Health for consideration, REMSCO conducted a public hearing and recommended approval for a parcel's expansion, volumes expansion into Queens County in Board for family Corona in Elmhurst. Joseph Rieri, Executive Director, sent the regional infection control preparedness assessment survey to the regional EMS administrators to announce partnership between the Regional Council of New York and New York State Department of Health, assess and improve infection preparedness for EMS agencies in the region, citing lessons from COVID-19 and emerging infectious diseases. All EMS services were requested to complete the 2025 EMS infection control assessment survey by June 27th, which would guide upcoming training, policy development, distribution activities. Now, if you want to add anything to that, Jeff.
I'll do that during the staff.
Okay, so that's all I have for the correspondence report. Of course, you're all free to read the copy yourselves. And so next, we need approval for the correspondence. So staff reports. We'll start up with first preparedness update.
Sure. Before we get into staff reports, we do have the completion of the nominations or two folks if you want to.
Great, great,
We
great.
can make those official.
Right, so, okay, so, Constantine, Constantine Caratine, 15 votes received. Stephen, Lusso, JD, okay, 15 votes received. Okay, 0 abstentions, okay, so, they're both, thank you, unanimously. Which is no surprise, there were two really excellent selections to join our council. Thank you all. All right.
All right. Thank you, everyone. I hope we have all had an excellent summer. So over the summer, the offices of the council have been quite busy working on a number of projects. First thing I'd like to do, as I'm sure everybody here is already aware, because we've done this throughout all the subcommittees and via emails, would like to introduce our new emergency preparedness coordinator, Mr. Juan Guzman.
Hello.
So Juan is a paramedic and CLI with over 20 years of experience in the system. I'm sure there's a number of folks here sitting around the table that have worked with him in the past. So Juan's already been working on a couple of projects, and we look forward to him presenting on some of those in the future meetings here. In addition to that, one of the main projects we've been working on over this summer, which will be continuing over this fall, is as was reported in the correspondence report, we sent out we collaborated with the New York City Department of Health's hospital preparedness program to renew our infection control program here in New York City for EMS. So the last time we rolled that out was back around during Ebola in 2015, 2016. Right, during that time, we did a gap analysis. We rolled out a series of training programs and distributed PPE. So in this program, we renewed that. Now updating that program post-COVID, adding some new educational guidelines. So once again, as most everyone here is aware, we did send out another infection control EMS assessment survey. Hopefully, but we did get a positive response on that from the EMS services, and we thank all the agencies that participated. That allowed us to do a gap analysis on that, and we began rolling out an infection control standards and practices program. We did a pilot rollout of that back in June. We are currently working on revamping and rolling out a new infection control EMS infection control officers program that will have 3 stages to it. So one will include an infection control awareness course, which will be a web-based program that will live on our LMS. That's going through its final reviews now, will be posted on our LMS shortly. The second component will be an infection control standards and practices. That'll be an in-person, hands-on session, focusing on PPE donning and doffing and fit test training. And then finally, the last component will be an infection control officers program, which will actually teach a EMS supervisor or leader how to actually run the infection control program within your agency. All right, so they'll teach you all the requirements for it. It'll teach them as fit test instructors, how to don and doff the PPE, and how to teach that infection control standards and practices program. That'll be a trainer level course. So that'll be starting to roll out later this fall and continue to roll out into next spring. As a friendly reminder, New York City REMSCO, we are a naloxone distribution program. So we are an opioid overdose prevention program designated by the City Department of Health. So with that, if any EMS services need naloxone for your agency, particularly in support of the Narcan Leave Behind program, please contact our offices. We're happy, we have it available, we have it in stock, we're happy to distribute. We are also working, if any service wants to become a naloxone distribution center, if you do community-based trainings and things like that. We are in talks right now with the City Department of Health to be able to run a distribution, trainer level program here out of REMSCO. So that's something for that. It's good for you, those of you that maybe run community training centers, first aid programs. So this way, as folks take your first aid classes, you can actually train them in how to use naloxone and actually distribute leave behind kits for them. So that's pretty good if you have teaching at-risk programs. As Dr. Krupe stated, on October 15th, we've collaborated with Mount Sinai and as well as the NAEMS, National Association of EMS Physicians, to host a quality improvement workshop on October 15th down at Sinai downtown. So we currently have about a dozen people registered for that. So we have about 10 seats still open, 20 seats still open for that course. We're serving breakfast and lunch. Any of your EMS providers that are interested in learning about quality insurance, the PDSA cycles, it's an excellent program. Highly recommend that you have folks attend. In addition, back in January, we applied for New York City Council discretionary funding, and we are happy to announce that we are receiving a $1 million grant to conduct an EMS mental health pilot program. This will be a great expansion on our current EMS peer support team. So a couple of the components that'll be part of that is we're going to be obviously bringing in some staff members to run this program. We've been having it for about 20 years now. It's actually the first thing that I worked on when I first started here at REMSCO. The thing that's always held us back is having consistent funding. So we get funding, we do a lot of activities, the funding dries up, and that makes it difficult to continue to do trainings and hold meetings and do events and things like that. So this is a pilot program for city council initiatives. So that means if we are able to do this successfully, we can hopefully move this from pilot into line item budgeting and actually have this be a consistently funded program for our EMS providers. So some of the highlights of that program will include a great expansion of our EMS peer support team, rollouts of trainings. So that includes critical incident stress management, QPR, suicide prevention, as well as the NAEMT mental health resource officers training. So we'll be rolling out all those programs. We'll be expanding the availability of our 24-hour mental health hotline, including making it so that it's more likely that there'll be more clinical clinician availability on that hotline. A real core part of the program is that there's going to be a dedicated fund to ensure EMS providers can get enhanced and long-term care at no cost. So covering things like co-pays, insurance gaps, and the main focus of this is if anybody calls our mental health hotline, in that phone call, we're going to develop partnerships with various mental health clinical providers and programs, is that we'll be able to get them in a referral and their first appointment within that phone. That's kind of the goal. So no more calling, and then we'll get back to you. We'll see if we can get you connected. Nope, you make a phone call, get you on with a peer support. They do that initial kind of intake, and then their whole job is to get you handed off to more long-term support and care depending on what you need, whether that's addiction services, grief counseling, whatever it is. So that's the goal of that program. We're excited to be rolling that out. There'll be more to come on that. We'll be reporting on that at each meeting moving forward. Any questions on the mental health program before I move on? All right. So another thing that we're working on at the office, another project, is we're working on doing some automations for some of the things that we work with our providers and agencies on. So that includes the REMAC provider list. Currently that gets posted every quarter. We're working on an automation now that as soon as a provider renews their credentials, as we update the database, it'll be a dynamic database that'll be accessible on the website. So it'll be easier for your EMS agencies to look up the status of their REMAC credentials. In addition, we're also working on doing the same thing for EMS course listings. We worked with the State Department of Health to modify how course sponsors submit their courses to them to include some pieces that indicate whether the course is publicly open or if it's open registration, if it's tuition. So this way, as we get the notifications for that, we can have those auto posted on our website for individuals looking for EMS training. In addition, over the summer, as announced at the May REMSCO meeting, we worked with New York City Emergency Management to provide free Life Pack 15s to the New York City volleys that are ALS. And we did complete that. I believe all of the services participated in that program.
Yes.
So, which is only 5 volunteers that are ALS in the city. They all participated, and at the end, I believe we distributed about 30 Life Pack 15s, or was it 20?
Out of 30.
Yeah, I think it was about 30. So we do want to thank NYC for the collaboration on that, and that was a nice program. The last thing on my report for this is just to give the territories a heads up. We had a meeting with the State Department of Health. They have one of the things that they are doing with their EMS agency renewals is for EMS services that have certificates that do not have clear political boundaries for their operating territory. They're directing those agencies to come to the REMSCO to provide clarification of territories. So we have received a couple of those already, and at the next meeting, we will likely present those with recommendations for the committee. So those will generally be brought up first at ambulance. Ambulance will make an initial recommendation, will come up to here as a seconded motion to the council. So most of it is like if a service has a community name, but this mostly impacts the volunteers. So like if a volunteer says, oh, we cover Roxbury. Roxbury is a name of a neighborhood, but it doesn't have a clear start and end to the territory. So they want that changed to preferably to community boards or something more definitive west of 34th Street in Brooklyn or something. So something that is very clear and not changed. So that concludes the, is any last questions on anything I covered? All right, that concludes the staff.
So now we're up to training education, program agency update.
All right, so program agency report, program agency update. We finally received our contracts, correct. So we received so the state finally released the program agency contracts statewide. Contracting period is for July 1st, 2024 through June 30th, 2029, broken into 1-year increments for operational periods. So we finally received an actual contract for fiscal year 2025 and have been requested to submit our budget for fiscal year 26. So now that we're in a new contracting period, both the REMSCO offices as well as the city fire department will be presenting, hopefully at the next meeting, our budgets for those projects. Because our job as program agencies is to do the work of this body and the REMAC. And as such, you are entitled to know what the money that's being provided is being spent on. Yes, Dr. Cooper.
Did we receive the payment for 2004, 2005?
We have not received any payments yet. We currently have our first voucher for fiscal year 25 awaiting approval.
I meant 2024 to 2025.
So also the answer to that is no. So the state owes us lots and lots of money for both us as well as the fire department.
Do we have any sense of when the check may be coming, at least for the previous fiscal year?
So my understanding is that once we get approval for vouchers, it's net 30 days. Our voucher for Q1 2025, because they are only allowing us to voucher for 1 quarter at a time. They will not allow us to voucher for the entire fiscal year that just passed. So once I get approval for that, it's net 30 days before we should expect it. Or we should expect payment within 30 days. So it's all a matter of when they consider it approved, because that's when they say that they officially received it. So a couple of highlights just from the new program agency contracts, and one of which will require some action, or we're going to ask for some action from this committee. So it does include $15,000 each year for recruitment and retention. So that gives us a little bit of funding to take on some activities. We do have a recruitment and retention tag. Currently, that tag has 3 members on it. Yeah, it has 3 or 4 members on it. So one of the things I'm going to ask the chair, if the chair could open up a little bit later for unfinished business or new business, to see if we can ask for some additional folks to join on that tag to help with some of the work. I know that tag is also looking for a new chairperson to lead its efforts. So now that we have a little bit of funding, we can do some things, some fun things with it. Some advertising, whatever the tag can come up with. The second highlight of the new contracts, it does include $20,000 for paramedic scholarships. So we will be allocating that for the Dr. Fitzy scholarship, which we've offered for a number of years. The filing for that will be opening up, we usually open it up, I believe, January or February 1st. The exact date escapes my mind, and we make the announcements before EMS week of that. And then finally, one of the things that's come up is there's been a number of new program agency directors that have been put in place. We're looking at one of them. But we are working with some of the smaller program agencies to help them with the state contracting process. A number of them have been struggling with that, and so we are providing some technical assistance. And that concludes the program agency report.
Any questions, Joe? Okay. Training and education committee report?
Training that met on the past Fridays, 6th. We discussed a number of things. I'll highlight the most significant ones. Number one, we discussed the protocol updates that we're going to be putting out before the end of this year. The changes in protocols were really pretty minimal, mostly language change. We're going to put out a very small, simple package like we've done on the LMS. It's not going to be a video driven. It's going to be a very quick, easy thing to accomplish. So that should hopefully be done by the end of October, beginning of November. In terms of unfinished business. So we looked at the, we've been trying to get monthly journals in the fire department up on the LMS. So now that we have one on board, have some additional support. And so those are forthcoming. We'll be able to get those on board. So there's additional CME that will be available throughout the region. A project that we're going to take on for this year, we identified a gap. New providers that either come into this region or become certified, newly certified, are missing a component, right? You take a state exam and you get certified by the state, you know, the protocols, and then you're at somewhat of a disadvantage, and agencies typically have to fill in that gap. There's probably some inconsistency because there's no standardized training program for people to follow. So we're going to work on creating that gap, developing that gap analysis, and providing some training that will be available on the LMS, so agencies can send their folks there, both EMTs and paramedics, to get what's there between the state and the region. Most notably, really more for EMTs and paramedics. Paramedics will have to take the REMAC exam anyway, so they'll have to be comfortable with it. So,
Thank you, Morton. Any questions for Relax? Okay, moving on, quality, REMAC, the report. Joseph?
All right, so REMAC met on September 16th, and the following is a summary. Some items need to be voted on, I think, this committee. We had approval of a bunch of different positions to the committee. I believe all of these approvals need to be voted on here. I don't know if you want to take them in mass or one at a time.
Yeah, I'm okay with doing it together.
So Dr. Kara Tubman was appointed as an alternate for as a representative for New York Health and Hospital. Dr. Lauren Kosterko moved from an alternate position to the Greater New York Hospital physician representative to the New York City REMAC. Dr. Christopher Cusack was appointed to Dr. Alexander's seat because Dr. Alexander retired. Dr. Bob Hoke was approved as a EMS Community Emergency Department physician with Dr. John Vega as his alternate. And those, oh no, another one. Dr. Daniel Eckroth was elected to the Psychiatric Emergency Physician seat for a 2-year term, effective July 1st, going through June 27th. And those, let's start with those. Those are appointments to seats that need to be voted on. Are there any questions about these appointments or what?
You do a handball or? The handball discussion. Yeah. Okay, so all in favor, raise your hand. Anyone opposed? Anyone abstain? Unanimous.
Okay. Doctors David Langley and Dimitri Alexis are the two new EMS fellows for this year. They replaced the outgoing EMS fellows. They're available as alternates to the EMS, to the fire department positions. But they're just appointments through their to the fire department. Dr. Adam Gottlieb and Terrence Lau were elected as at-large members, 2-year terms. I believe that needs to be voted on as well. And so let's vote on that, and then we'll get to the last bits of information, and then we'll.
Okay, so who are we voting on?
This is Terrence Lau and Adam Gottlieb. Adam Gottlieb is a paramedic, Terrence Lau is an EMT. They were elected to at-large members for a 2-year term.
Okay, so, again, hand vote, so all in favor, raise your hand. Any no votes? Any abstentions? Again, unanimous.
Okay, the rescue task force revisions, their protocols revisions, and the fire department special operations command hashtag GOP revisions were approved. The changes are predominantly typographical, so they were sent out in a regional advisory. They will not go to the state. They will just be added to the region. These are specifically only for the rescue task force and the hashtag. CNC is focusing on updating the REMAC exam questions. The STEMI tag is planning on having a stakeholders meeting at Greater New York, I believe, sometime in late October. We will also be meeting the EMS patient destination tag. We'll be meeting predominantly to discuss the concept of medical complexity and to define it a little bit better in the region. So rather than it being just at the discretion of the online medical control physician, there is a more formed definition. And the interfacility tag released their guidelines, which were sent out to the region for review. They will be discussed at the next meeting, which is on October 21st, and that ends the report.
Very nice. Any questions for Joseph? Yeah, very good.
Thank you.
So- Oh, it's quality improvement. Okay. So I guess I'm quality improvement. The Cloud Improvement Committee gave your city, virtually is September 29th, 2025. The following is a summary. No regional restriction case from use or data requests were received. The committee received 2 core-sponsor applications from Brooklyn College EMS, University Education Services, Inc., and NYU Langone EMS. The additional information was requested by the committee before proceeding to recommend the application. Regional training for the first project dashboard was held on June 12, 2025, and a video link will be distributed. The committee is planning to move forward with 2 specific data points for providing feedback to agencies. First, the blood glucose safety level for stroke. Second, aspirin administration for STEMI. And Dr. Kostersko will collaborate with Joe Ranieri offline to start analyzing these data points. Mirzal Islam, the new University REMSCO intern, can provide an update on the airway management project. More information will be shared in the next meeting. The regional will host the NEMSP course on October 15th, which is mentioned. Flyers are distributed to the region for registration. The committee discussed the need to establish an electronic process for hospitals and EMS agencies to submit QA data related to kidney patient destination policy. That's all I have. Any questions? Good. Okay. Moving on. Legislative committee report.
And the legislative committee did meet on the 15th of September. We've been met at least twice over the summer, reviewing Article 30, the current proposed changes. to Article 30 and making our own changes on top of those. We had gone through the Article 30 and we're pretty much at the point where we're going to be looking at all of Article 30 a little more closely and even considering, is there a possibility of asking our legislators to separate New York City from the rest of the state's needs in Article 30, because we're so different. And it seems like every year we try and work with State Department of Health and our requests never go through and we're back to square one every year. So maybe what we need to do is just get our own requirements for the city. And actually in the past, when I spoke to at least one of the chairs of the health committees in the state assembly, Senate, they asked us if we just want a New York City. But we don't know if it's going to come to that, but it's something that we're at least looking at. And we will be dealing directly with legislators. We're not going to be asking. Also, state legislation regulations, Part 800, ambulance equipment standards were approved by REMSCO, with New York City comments incorporated. That's another thing that we worked on over the summer. Publication is anticipated within 4 weeks, and the standards will take effect 6 months after. Regulatory initiatives under development include ambulance build standards, flood administration, system agency performance, and community paramedicine requirements. Pending legislation of relevance includes S 8486, which is treat in place, and S 1515 property tax cap exception EMS. Also S 6698 minimum staffing standards for city over 1 million. And anyone that wants to look at the documents we're working on, we have a side-by-side that compares current Article 30 proposed provisions from REMSCO, I mean. So, and that will be available to anyone on this council that wants to participate. Other items that were just discussed is REMAC should coordinate and inform the Department of Health, but not be subject to state approval for our operational decisions, which I thought pretty much, we don't ask them how we operationalize our protocols. That's specific to New York City. Also, we want to, what we'd like to do is have REMAC submit protocols to CMAC, but for informational purposes only, not for approval. And to update the language in Article 30, we'd like to replace the word emergency with emergency medical services, but obviously we respond to not just emergency calls, we do transports, we do all kinds of work, and it just seems like it's limiting us. So we're going to suggest out of hospital, pre-hospital care as a change to legislative language. And we also want to remove, what happens with the state is a lot of the language that gets put in proposed, there's a lot of language, so much language that you can't really be sure what it means or how it will be interpreted. So our suggestion is the less language, the better, to make it easier to interpret. And also continue to have this problem with the state Department of Health with regards to REMSCO and CMAC when we nominate people to be placed on the committee. And it takes sometimes months or years for people to be vetted. By the time they're vetted, their term has expired. So in law, we are considering putting in that the nomination process be completed within 60 days and make it their problem, trying to figure out how to run their internal bureaucracy so that our people don't have to wait quite so long to be seated. The next meeting of the legislative committee will be on October 20th.
Okay, thank you, Maria. Any questions, comments?
When our Cooper, by the way, when the 1992 version, revisions to to Article 30 were passed, it was the last, overarching review of Article 30 that made it into law. There's a very, very long section regarding the responsibilities and authorities of the regional council. It's worth a review by the legislative committee to take a look at that in some detail, because there are an awful lot of authorities granted within that section of the law that that could be used but have not been.
Where is this art?
It's in Article 30. If you read the powers and duties of the regional council section, there are all kinds of duties that the council has. The state has never felt real comfortable with councils actually doing everything that's in that section, but it is there in law. If some of the issues that the legislative committee feels are not being fully addressed at the state level, are deemed to be relevant to the current section in 3003, it might be worth double checking and seeing what we can accomplish under current law.
Well, we'll definitely take a look at it. Part of the problem, there are many things that the regional council have authority for or are responsible for, and the Department of Health just ignores it, or they reinterpret it. For example, when it comes to program agencies, the regional councils are supposed to have a say if a program agency is approved, continue to approve. And there are times when the state simply ignores that. And also our roles in approving training programs. We really have no authority any longer in approving training programs. It's just really a rubber stamp. So there are plenty of items that we need to look at. And I think a big part of the problem is when you have new people looking at legislation, but they don't know the reasoning behind why that legislation was created. It leaves a lot of room for them to make changes more to the betterment of the state agency rather than the individual regional councils. But thank you. I'll definitely look at it.
Okay, any other questions, comments? Okay, so I'm gonna move on to the state EMS council report. Okay, CMAC REMSCO met on September 1910 before New York. These are some of the items. Again, you can have the full copy of
Yes.
breaking down KTA what was discussed, KTA approved those meetings. But these are some of the highlights. Okay, approved by CMAC REMSCO. Motions, there were no approved motions by CMAC. REMSCO approved the proposed change to Part 800 equipment regulations. Bureau report, the annual EMS memorial will be held in May next year. Any nominees for inclusion should be submitted as soon as possible to ensure adequate time for preparation. The fire memorial will occur October 2025 this year, with 127 names added. Many of which are related to 9/11 illness. Vital Signs Conference will be held November 7th through 8th this year. KT registration is open. Paperwork has been submitted to the Department of Health and Human Resources Division for establishment of a state medical director position. Once approved, the position will be posted for public application. SEMSCO presented on Hudson Chair, Tim Egan first vice chair, Alfred Kim second vice chair as officer nominees. The Bureau has announced the appointment of new investigative staff. The EMSC, the National Preparedness for Children Survey, has been released. All hospitals struggling encouraged to participate to provide accurate statewide assessment of pediatric preparedness. The 2020 survey conducted during the 2019 pandemic had limited participation, so we're looking for better participation this next round. CMAC held substantial discussion regarding appropriate dosing for pediatric sedation. Evidence remains limited, and there is little consensus on optimal strategies to reduce discomfort for children undergoing routine procedures such as venipuncture, gastric replacement. As examples, a national work group is developing guidelines to address this gap. Medical standards, the BLS robotic airway policy developed is near completion and undergoing legal review for inclusion in EMP scope and practice. Okay, at present, BLSFR agencies will not be eligible as they are not regulated entities. Further discussion will address potential airways for BLSFR participation, including appropriate oversight and defined scope. Opportunities exist, the KK separately, separate item, options exist for standardized training, intervention process across the regions. Training ed, okay, the committee addressed question regarding regulation of regional credentialing for agency medical directors. Previous determinations conducted that such credentialing should remain at a best practice rather than a statewide requirement due to concerns about creating excessive burdens for some regions. The medical record, right directive verification form does not currently have REMAC approval. Again, and it remains unclear whether regions have the authority to impose such requirements. The working group will meet with Division of Legal Affairs at KK to explore potential mechanism for REMAC approval. Finance Committee, the committee also discussed the pending expiration of Medicare grant ambulance add-on payments on September 30, 2025. Where extension urban ambulance services would face a 2% cut, rural service a 3% cut, a super rural service a 22.6% cut. If the pay-as-you-go act trigger is not waived, Medicare payments could be reduced by additional 4%. REMSCO is sending advocacy letters to Congress, aka NEMT has developed a tool for providers to conduct their representations. Safety Committee is reviewing draft revision policy 00/113 regarding EMS vehicle operations. A new restraint policy expected to be presented in summer 2025. Quality metrics, committee is drafting standards for facility names, crew IDs, and snowman lists. A draft self-assessment survey tool being circulated. Program agencies will be providing agencies with data on successful and failed chart exports. Expansion of the CARES registry to include hospital outcomes feedback is progressing with the New York City pilot advancing. And the mover protocol utilization reports are being distributed statewide. Quality improvement education will be featured at the Vital Signs Conference, and New York City REMSCO will host the NESP QI workshop on October 15, as was mentioned earlier. So those are basically the highlights. Again, I think the full report is available if you'd like to see it. Okay, so any questions about anything I just mentioned? Okay, so moving on takes us to unfinished business. Any no unfinished business. So new business, we got one item out of the way. I think our elections. So thank you very much for giving us a quorum today, so we can vote on our new members. My reappointment is the next item up. Is for reappointment to the State EMS Council, as representative. Anything we need to do with that?
We do have to vote.
Okay,
I'm moved.
so show.
Do you want to be appointed?
Sure.
I'll second the motion.
Well, in favor? Okay, opposed? Abstentions? And I don't think I ever called the vote, so no. I called the vote for myself.
So just to note that this upcoming term is Dr. Krupi's last eligible term for REMSCO. So he will expire. He's actually technically already halfway through this term. So this term expires in December of 2026.
Yeah.
So starting next year, we'll have to make a decision as a council on providing the state with 2 nominees. That will likely occur at the April or June council meeting. So if there's anybody that is interested, normally one of those nominees is by default is the chair of the REMSCO. If there's anybody else that would additionally like to consider representing us at the state council, please pick it over, and we'll be opening that up probably at the start of the year.
Yeah, and a point that Marie made earlier, when I was appointed, the state, council representative, it took me 2 years to get vetted before I could cast my first vote. 2 years. So hopefully we get to do better for my replacement.
That would be nice.
Yeah.
Lorraine will be up there forever. Never escape.
All right, so next item is a vote clarification operating territory for Roxbury volunteer fire department.
So, this was addressed by the volunteer technical assistance tag, right? I believe so. What's that? Oh, the executive board. So the executive committee of the REMSCO, so we received a request from Roxbury Volunteer Fire Department for a clarification of operating territory. Like we said, this is one of the things going on with the state. Mostly affects our volunteers here in the city, but there's a couple of other agencies as well. So the executive committee of the EMS Council identified the application was identified, reviewed, discussed, and voted upon. The regional council approved the following motion, which has been forwarded to New York State DOH for consideration. The REMSCO NYC, which has conducted a careful review of information materials and the record of this matter, has endorsed the need for clarification and has recommended the use of precise terminology and wording that most accurately describes the agency's existing service area, without any expansion or reduction of its current operational limits, which is Rockaway Peninsula west of Beach 146th Street in Queens, New York. So for those that are familiar with the Rockaway Peninsula, right, Beach 46th Street runs completely north-south of the peninsula. So anything west of that would be Rockaway's territory. That completely mirrors their current territory on their current certificate, just changes the language from Roxbury, Rockaway Point to this territory, as I stated before. So that comes as a second motion from executive.
So you need to make a
We need to,
motion.
it comes a second, so it just needs to be voted.
Okay, so you want to state exactly what we're voting on? So
What we are voting on is the approval of the following language for Roxbury Volunteer Fire Department's operating territory, which is Rockaway Peninsula west of Beach 146th Street in Queens, New York.
Oh, okay, roll call. Okay, so we do a roll call vote.
When I call your name, please say in favor, against, or abstain. Jason Zimmerman,
Favor.
Andrew Dahl,
Abstain.
William Goffin, or Dominic Buttonell. Grace Cacciola,
In favor.
Dory Gutzman,
In favor.
Detective John Gregorio, or Ed Jarvis. Bristol and Max Goldfarb, James Pointer, Gerald Gilbert, or David Kapitansky, Joseph Schenker,
In favor.
Michael Rayola,
Favor.
Mark Relax, Martina Becquerel, Marie Diglio,
In favor.
Nancy Benedetto, Arthur Cooper,
Favor.
Robert Ruby,
In favor.
and Hughes, Benjamin Fay,
Favor.
Michael Coombs,
In favor.
Dippy Langston, Brian Levinsky, Martin Barzilay.
Okay, 14 pages, so
We have to be,
The quorum?
to meet quorum, but
What is the?
does it have to be, a majority of the whole number of members?
Majority
has to be.
quorum?
No. So, I think it's the whole number.
What is the number needed for a quorum? 16?
The number was
It's either 14 or 16. So I think
Whatever the number that is needed for the quorum is the majority of the
Yes.
quorum.
right.
yes.
So that's what you would need to pass a vote.
Is it, but right, but does the law talk about the majority of the quorum, or is it of the whole number of the
The
members?
whole number of
It's the whole
members
number.
would be law.
I think we're short too. I think it's supposed to be 16, but. That's 14 on it? Okay, then it's 14.
Passes.
Okay, so it passes.
It has to be at least the number of the quorum.
Right.
That's, sorry.
Okay, great. Next item. Clarification for operating territory policy procedures adoption.
Yeah, so, so one of the things that, since we will now be seeing more of these, clarification of operating territory requests. So a couple of the other regions, they have a more formalized process for this. The one that we did today was very simple. There's no conflicts or anything like that. So, but we may see ones that may be a little bit more complex to consider. So, we wanted to put together a guidance for this committee on how to navigate these clarification of operating territories, standardize the process of it. There are other regions already have that. So we wanted to put it down to ambulance committee to put something forward so that this way we just have a guideline to work off of and nobody can dispute the decisions of the council and say that we did not do our due diligence.
Okay, so we'll give this to the ambulatory committee to bring something back to us for consideration.
Correct.
Okay, great. Any questions about that? Okay, next item, programmation deliverables for the New York City REMSCO.
We will,
We covered.
yeah, we're going to present that at the next meeting.
Okay.
We're still waiting on some budgeting pieces on the fire department end. This way we can present that jointly.
Okay, and Joe, earlier you mentioned about forming a tag that we've been discussing in new business.
For recruitment and retention.
Yeah, so
Yeah.
one of the things that we wanted to, so we have a recruitment and retention tag already. We would just like to put that out to the body to see if additional individuals would be interested in joining that tag. Like I said, we got a little bit of funding, so the tag can do some more things and they could use a couple of additional hands to help get the work done.
Joe, does it have to be limited to REMSCO members when we ask the agency? Recruitment and retention officers.
As a tag, it is not limited to members of the body. It can be any individuals that the chair deems appropriate to sit on the subcommittees or tag.
Yeah, makes sense.
So if any agencies, if you want to give up one of your personnel, and force them to join, it would be better to have someone that actually deals with recruitment and retention in an agency. So that we can do something real. Nobody wants to hear me anyway. It would be good for agencies that you could put forward one of your staff members or a volunteer, someone that works in recruitment and retention, so we can get some real type of information rather than, from those of us that don't actively do recruitment and retention. So it's just a thought because there's only like 3 or 4 of us on this committee and this is not going to work.
Yeah, but you could have good representations of different agencies when they had different issues with recruitment and retention. You get to hear different sides. Good.
I think one thing that we've noticed would be really helpful if anybody has experience in grant writing too. Because I know we got the additional funding from what Joe mentioned earlier, but it'd be great to have somebody on board who knows how to write grants. It'd be really helpful. If you guys know anybody, send them our way.
Agreed. Right, any other discussion on this? Any other new business? That's I think I reached the limits for my list here. Anyone else involved to raise new business?
I just want to ask if staff can send out an email to all the agencies asking them if they have somebody from their agency that will be interested in recruitment and retention. Spread it out.
It's a big issue. It's
Yeah.
a big issue for a lot of agencies. And increasingly so, unfortunately. All right,
I have 2 items for the business,
Oh, good.
very briefly. So one of the things that was announced at REMSCO was the state, the Division of EMS did actual fine work in getting EMS paramedic programs approved for the CUNY Reconnect program. So CUNY Reconnect is a program that's designed for individuals that have not to be able to go back to school and get a college degree, at least an associate's degree, at no cost. So our CUNY paramedic programs here in the city have been approved to be part of that. So one of the things that we'll be taking on, along to help with the recruitment and retention tag, is putting together an information package on what the program is, how you apply, who's eligible, what programs are eligible for it, right? Just kind of navigating the drudgery that is the CUNY network and processes. So that's one of the projects we'll be taking on and working with the recruitment and retention tag on. So I wanted to make everybody aware of that. The last thing I do also want to point out, you'll notice we have a couple of additional folks joining us this evening. Mirazul Islam, Mirazul, if you want to raise your hand, and Kadiatu Diawara. So they are our interns from CUNY. They've been helping us over the summer on a couple of different projects. Mirazul's been working on some QA studies for us, as well as doing EPCR support. And Kadiatu's been working on some of those, some of the data informatics pieces I described earlier. So they've been with us for the last 9 weeks or so, and we have them for a couple more weeks with us. So I just want to acknowledge them and the work they've been doing to help assist the council.
Welcome.
That's all I got, I promise.
What's the name?
CUNY Reconnect.
A request that came from the council gave that EMSH update their contact information. It's really important that we be able to reach out to you, be connected when information needs to be shared. So please, you reach out to Michelle, make sure your contact information is updated. Right. And I guess we'll end by myself thanking everybody for coming here this evening. I know it's not always easy. You have busy lives. Okay, work and other things going on in your lives. You making the time because without you being here, without having a quorum, we can't do our business. There's really no point. Okay, without your participation. So again, thank you so much, Morty.
Motion to adjourn.
Oh, yeah, I'll take that. I think we have a second. So meeting adjourned. Thank you.
So,
No, you.